Hello and welcome to a webinar about Medicare Open Enrollment 101. My name is Christine Simone, and I am the CEO and founder of a company called Caribou. We are not affiliated with Medicare Wealth Management. However, we are a close partner in healthcare planning for the firm. As the founder of Caribou, I care a lot about this subject. Healthcare and health insurance is a very confusing and complex topic, and hopefully as we go through this webinar, we can bring a lot more clarity and confidence to your health insurance choices as you enter into the Medicare Open Enrollment window. First, we're going to talk about why Medicare planning is so important. We're going to go through the Medicare basics. We're going to talk about how to pick the optimal coverage, and then the action and next steps that you can take during the open enrollment period. We're going to be exclusively focusing on individuals who are looking to change or reevaluate their Medicare coverage over the open enrollment period, but that is by no means the only opportunity where you can turn to your advisor with healthcare related questions. There are lots of other life events that impact your healthcare costs, like retirement or relocating, for example, where you can approach your advisor and ask them about how those changes impact your financial plan. When it comes to open enrollment, it's especially important because this is basically the window of opportunity where you can shop around for health insurance for the upcoming plan year. And the reason why you want to do that is because every year plan designs change, meaning that there could be different premiums, out-of-pocket maximums, deductibles, provider networks, drug formularies, or preferred pharmacies. All of those things are changing on the plan design side, but then your needs are likely changing too. Whether it's new medications or an upcoming procedure or treatment, you want to reevaluate and reassess the coverage that you currently have for the upcoming year. Of course, there's no crystal ball, there's no guarantees, there's no way to predict exactly what's going to happen, but at least this window of opportunity unlocks the ability to sit back and think about your healthcare costs and needs over the last year, and compare that to what you think might be coming down the pike for the upcoming year. This is especially important because healthcare is making up more and more of your expenses, especially as you go into retirement. It's going to be one of the top 3 expenses that you incur. Drug prices have consistently increased by about 35% between 2014 and 2022. And overall medical services have also consistently increased by about 21% during that same time period. So while you can't predict costs in an upcoming year, you could almost guarantee that they are likely to go up. Not only because the costs themselves are going up, but because it's very likely that as you age, you will probably need more and more healthcare services. In addition to that, a lot of people overspend. They spend way more than they actually need to. And we see this quite clearly on Medicare drug plans specifically. Almost every single Medicare beneficiary is on a drug plan that is not optimized to their current prescription list. So just like an investment strategy or a financial plan, you wouldn't set it and forget about it. And the exact same thing is true of your Medicare coverage. So let's first dive into the basics so that we are all on the same page before we talk about the changes that you can make. If you are new to Medicare or you are watching this because you are soon to enroll, you might not be too familiar with the differences between original Medicare and Medicare Advantage. If you've been on Medicare for a number of years and aren't still familiar with the differences, that's okay too. It's very complex and convoluted, and we're going to walk through that together right now first. First, you have original Medicare. This is going to be Part A, Part B, what's called a Medigap plan, and Part D, which is your drug coverage, all together enrolled in separate plans. Then you're going to have Medicare Advantage, which is basically going to be an all-in-one option, bundled all together, all that same coverage, but by one single insurance company. So these 2 options are basically the 2 configurations that you can choose from. And then within each of these configurations, you actually have a number of private policies to pick from for Medigap Part D and then the Medicare Advantage side as well. Before we get there though, let's first cover what parts A and B cover, because that's actually included in both options. Part A is usually free and it's coordinated through Social Security. So if you are new to Medicare, you want to set up your Social Security account as a first step. It's free for people who have worked more than 40 work quarters or who have been married to someone who has worked more than 40 work quarters. And this is going to cover your facility-based services. So this is like your hospitals, nursing facilities, hospice care, and so on. Part B, on the other hand, is going to be income-based, and it's going to have a premium. So there's a base premium that everyone will pay, no matter the income. And then that premium will actually increase with adjustments based on your income from 2 years prior. And I'll show you what examples of that look like here in a minute. Part B is going to cover your medical services. These are your doctor's visits, vaccines, durable medical equipment. So parts A and B, again, are included in both options, as well as they're going to cover your facility-based and doctor or medical services needs. Parts A and B, though, are only going to cover 80% of costs. So this is why we have on original Medicare what's called a Medigap policy that's going to plug that gap. On the Medicare Advantage side, what you're going to do is you're actually going to enroll in a private policy that's going to bundle all this into one and cover that gap and cover parts A and B services. So that's why you have on this slide here, you have A, B, Medigap plus D. So this is again, facility-based medical services covering 80%. This is going to cover your 20% of services, and then you're going to add drug coverage into the mix. Whereas here, one insurance company is actually going to cover it all for you. So that's the key difference. You still get that same A and B coverage. It's just going to be offered by one private insurance company on the Medicare Advantage side. Rather than on original Medicare, you're going to have your red, white, and blue Medicare card. That's going to be your A and B. Then you're going to have your Medigap card that's going to cover the 20% that Medicare parts A and B don't cover. And then you're going to have your prescription drug card. So you're actually going to be working with 3 different wallet cards if you still carry those cards around in your wallet, versus Medicare Advantage, which is going to put it all under one private insurance company's roof. So it does make the coordination of everything a lot easier. The income adjustment is going to apply to Medicare Part B as well as Medicare Part D. On the Part B side, there's a base premium that everyone pays. This year in 2023, it looks 2 years back to 2021, and the base premium is $164.90. For anyone who files a joint tax return and makes $194,000 or less, that's the base premium. These bands that you see in the first column, the income bands, are going to change depending on your tax filing status, but Medicare's income adjustment is always going to look 2 years back, no matter what. So as we're heading into 2024, they're going to be looking at 2022. At the time of this recording of the webinar, we don't know yet what the income bands or the actual premiums are going to be for Part B, nor do we know the income adjustment for Part D. I mentioned briefly that Part D is going to be your drug coverage. You can see here, there's no income adjustment on the lowest band, but then the income adjustment starts to increase as you increase your modified adjusted gross income. IRMA is often what this is simplified as, and it stands for Income Related Monthly Adjustment Amount. Let's first go over original Medicare, which is going to be that Part A, B, Medigap, and Part D. We first already covered Parts A and B. That's 80% coverage that you'll get. So basically what you need to do now is you need to add a Medigap plan. And this is going to plug that gap, that 20% that Parts A and B don't cover. Medigap, as I mentioned, is going to be sold by a private insurance company. So it's going to have its own card and a separate carrier that you are going to be working with. And most states follow a 12-lettered plan system. We see a lot of clients on Plan Gs, high deductible Plan Gs, or Plan Ns. Those are the most common. There are a few states that don't operate by this system. And so if that is the case where you live and you're watching this and you have any questions, please feel free to go to your advisor and they can provide you with some resources about those states. Plan G is going to have the most comprehensive coverage. All that you will pay is the Part B deductible on top of the premium here, whereas a high deductible plan is going to lower your premium but increase that deductible. Again, we don't know what 2024 is going to be, but it's going to be in and around $3,000 versus around the $230 that it is right now on a Plan G. When you are deciding your Medigap plan, it's really important to consider that every plan with the same letter has the same baseline benefits. So an expression that we like to use is a Plan G is a Plan G is a Plan G, or a Plan N is a Plan N is a Plan N. They actually all have the exact same baseline benefits. So while the Plan Gs are very common, you don't have to worry so much about which one you pick. What you want to kind of optimize for is probably cost and carrier and rating. Those are some of the most common things that we see people optimize for on Plan Gs because the coverage is identical. A Plan N can be suitable for people too who have lower healthcare utilization and a strong preference to reduce their monthly fixed costs, meaning that premium, but are okay with potential variable costs. There can be some excess charges in the forms of copays and coinsurance on a Plan N. Again, that Plan G is going to be the most comprehensive coverage and the one that we see a lot of clients on. There are high deductible options for individuals, but what's really important to consider when making your selection for Medigap is this is the one thing that is very, very hard to change in the future. So when you are picking your Medigap plan, think about picking it for the rest of your life. What happens is that if you don't enroll in a Medigap plan from the get-go, meaning you might enroll in Medicare Advantage, or you just don't enroll in any additional coverage and only have the 80% that Medicare Parts A and B cover, later on you will have to go through medical underwriting, and you could be denied this Medigap policy. Typically, we do not advise individuals to go without a Medigap policy or without Medicare Advantage because 20% of costs can be very, very high if your medical bills are hundreds of thousands of dollars in the event of a hospitalization or emergency, for example. So you do want to plug that gap, that 20% that Parts A and B don't cover. There are some states where that does not apply. Lucky states of Connecticut, Maine, Massachusetts, and New York. They have what's called guaranteed issue rights, where you can be, you will be approved for a Medigap policy no matter what, no questions asked, basically. There might be a small waiting period though, in and around 6 months potentially. So you have to keep that in mind if you are looking to switch. There's also some age-based restrictions, such as Plan Fs are available to some individuals who turned 65 prior to January 2020, as well as a high deductible option for that Plan F, as well as there's some state-based restrictions or differences, I should say, in states that don't operate by that lettered system and instead have a different system to the 12 letters. Here's an example of that. So on the rightmost column, you can see a Plan F. And this comparison chart, what it's doing is it's basically laying out some of the most important factors to consider when you are evaluating Medigap. What you don't need to consider with Medigap is provider networks. This is not true of Medicare Advantage, and we will get there soon, but 98% of doctors across the country accept Medigap policies. So here you can see Plan F, Blue Cross Blue Shield of South Carolina, got a great rating, premiums about $172, and there's no deductible that you have to pay on that Plan F. But if you remember what I said on the last slide, these plans actually aren't offered anymore, but some individuals are grandfathered into them. And what some carriers are doing to basically kick their beneficiaries off this plan, or encourage at least to kick them off, is that they're raising the premiums so high that the difference between the premiums and including that deductible into what you could pay in a given year it doesn't make sense to actually stay on that plan F. It's actually more cost effective to switch off and go onto a plan G. So you are seeing that here on this slide. You're seeing lower premiums, and then even if you add in that deductible, it's more cost effective to be on a different plan than that plan F. You also see a plan N here for comparison, lower costs, but again, you need to take into account potential out-of-pocket costs in the form of excess charges on that plan N. Once you've picked your Medigap plan, if you're on the original Medicare configuration, you need to add that prescription drug plan, which is going to be a standalone drug company or private insurance company, I should say, that's offering you that drug coverage. So this is different than your employer plan or a marketplace plan that is going to have your health and drug all bundled into one. Again, this is going to be a separate company that's offering it to you, and you are going to have a separate card, like a wallet card or an ID card that you need to manage. Each plan is going to have its own premium. And as I showed you on that table previously, there is an income adjustment that will apply. If I just quickly go back to that slide so you can see it, the lowest band doesn't have an income adjustment, but you're still going to pay the premium for whichever plan you pick. So you need to take that into account while you're financially planning for these costs. Then, depending on your income, you could have an income adjustment on top of that premium. So you will always pay something for Part D, just some people won't pay an income adjustment. There is currently no cap on drug costs, which is why Medicare costs vary so much on an individual basis. Drug costs are the one area where we can see people with all of their drugs covered and it costs them nothing, all the way up to people spending tens of thousands of dollars on their drug costs every single year. I have great news though to share is that in 2025, there's going to be a $2,000 out-of-pocket cap in Part D and other drug benefit changes as well. So this is something to look forward to. Advisors are looking very forward to this. Clients are looking very forward to this. It's going to result in a lot more predictability around potential costs for individuals as they are aging into Medicare and on Medicare. But until then, again, lots of variability in drug costs, and hopefully this change does go into effect, and hopefully it does impact every single drug on the drug formularies. Medicare drug coverage, not only is it different from prior plans you might be on because it's not bundled into medical services, but also the way in which the cost sharing is going to work throughout the year is going to differ depending on your specific costs. You have what's called the Medicare donut pool, basically, and it has 4 different phases that you could go through depending on how much you pay. So in phase 1, you will be responsible for 100% of prescription costs until you reach your plan's deductible. So whatever plan you pick, it's going to have its own deductible, and it could change every single year. And until you hit that, you will be responsible for 100% of costs. That's true of, your medical coverage as well. You pay until you hit your deductible. Once you hit that deductible, you head into phase 2, and your plan starts paying the majority of costs, leaving you with just a copay or co-insurance until the total drug costs reach what's called the initial coverage limit. And that initial coverage limit is going to be set by Medicare every year. Most people don't go past that. Most people stay in and around that area. It's a few $1,000s a year that initial coverage limit is. Some people, though, pass it and they go into that donut. And this is where they will pay no more than 25% of drug costs. Cost sharing will depend on various factors, like if the drug is a brand name or a generic drug, and the actual retail cost of the drug. This is basically where you will sit until you reach what's called the coverage gap limit. So this is a separate name, and that amount is also subject to change every year and set by Medicare. Once you've reached that limit, it's basically catastrophic coverage, and you'll only be responsible for the greater of 5% of drug costs or a small copay or coinsurance for your medications. So the point of this entire slide is that your share of potential costs with your drug plan could change throughout the year. So if you take a lot of prescription medications or your prescription medications are very expensive, you can anticipate paying a different amount for your refill frequency throughout the year. as you kind of transition through this donut hole. Here's an example of that. So you can see a robust comparison of potential drug plan options. You see here someone who is on a current prescription drug plan. That's what PDP stands for. They're paying about $30 a month, and they've got this $505 deductible. Here, if we look at the other options, we do see other options, $10, $79, $40, as well as different deductibles. This is $505 too, but this one's $0. So this plan will start to pay sooner than the other three options. So those are things that you can consider when it comes to evaluating your drug plan, but most of the time people are optimizing strictly for cost. You want to find the plan that is going to offer the best coverage for your drugs, because every year you can change this, no questions asked. You also want to look for the cost of your drug at the pharmacy that you are actually picking those medications up at. So you want to make sure it's a preferred and network pharmacy, as that's how you will often get the most preferred costs. In addition to that, you want to make sure that you're taking the most cost-effective version of that drug. If you're not familiar with brand name drugs and generic drugs, that is definitely a conversation that you want to be having with your physician. Here you can see this brand name drug was not covered by Medicare, but if you look up the generic version of that medication, which is the exact same drug formulary, meaning it's the same composition rather, and it's the same medication itself, the costs drastically decrease. You can see here they're about $5,000. Here they go down to $660 or $660 and $240. So really big difference. But again, you really want to be having this conversation with your doctor to make sure there wasn't a reason behind them prescribing you a brand name medication if you find yourself in this situation. That's why evaluating the plan from a cost perspective is not just about premiums and deductibles. You really want to be looking at the specific cost of your medication, because you can see here the costs really differ depending on the plan that you pick. This example shows that, again, I think in even more drastically and through a much more simplified version. You can see here that if this client picked the plan with the lowest premium, the $7 premium, their drug cost would be about $40,000. If they pick this plan premium, this AARP plan with a $38 premium or a $73 premium, that's reduced to about $5,100 or $5,300 respectively. Something to note here is columns 2 and 3 provide two different coverage options, two different formularies, two different premiums, but they're offered by the same company. So this will happen. Most companies will offer 2 to 3 different options with different drug formularies for different beneficiaries. So you really want to make sure that, again, you're evaluating more than just the carrier themselves, and that you are plugging your medications into Medicare.gov or talking to your advisor about this during the open enrollment. When you are considering that drug plan, one of the key factors, as I mentioned, are those specific costs of your drugs. But if you're not taking any drugs, the answer isn't not to enroll in drug coverage. The answer is almost always yes. You want to enroll in prescription drug coverage, even if you are not taking any prescription medications. You can always pick the least expensive plan option, and those can be $4 or $5 a month. Otherwise, a late enrollment penalty might apply. The only reason why it would not apply is if you have credible source of drug coverage through TRICARE, the VA, or a spouse who is actively employed. So if you yourself are not actively employed, the only place to get that credible drug coverage is again from TRICARE, the VA, or a spouse who is actively working. If your spouse has COBRA coverage, or if you yourself have COBRA coverage, that does not qualify as credible coverage per Medicare standards, and you will be subject to a late enrollment penalty based on the amount of time that you didn't have drug coverage. Additionally, you won't be able to enroll in drug coverage throughout the year. You can only enroll in drug coverage during your initial enrollment in Medicare, either when you first turn 65 or you retire after 65, or open enrollment. So if you get prescribed something in March, unfortunately, you have to wait until the next open enrollment period if you chose to opt out of drug coverage. And then that coverage will go into effect the first of the following year. So you could be without prescription drug coverage for that long amount of time. Again, Medicare Advantage is going to have that embedded drug coverage. That's your all-in-one option. And so you also want to be making sure that you're picking a Medicare Advantage plan that has drug coverage included in it. There are some options that do not for people who might have TRICARE, VA, or a spouse's employer plan to pick up that drug coverage. So again, that original Medicare configuration is going to have parts A and B, your Medigap, and your Part D. You're going to have 3 cards that you're managing, whereas that isn't the case here on the Medicare Advantage side. This is going to include parts A, B, and often D, all under one roof. This is going to be offered by approved private insurance companies, and your drug coverage is going to work the exact same way. So everything I was just talking about with drug coverage also applies to Medicare Advantage. There's no current cap on drug costs. You're going to pay the income adjustment. And if you don't enroll in a plan that has drug coverage, you could be subject to a late enrollment penalty. Medicare Advantage is going to make up the majority, if not all, of the advertisements that you see, especially during open enrollment. This is often hard to see through. However, the agents and insurance companies who are potentially selling or advertising these plans are going to often advertise that they are free, that you don't pay anything for them. But I'm going to walk you through a couple examples that show you how that's not entirely the case. Other things that you need to keep in mind with Medicare Advantage is that you will need a higher likelihood of pre-approval for services, also called prior authorizations, referrals, as well as you might be limited to a specific network of doctors that is local versus the flexibility that you have on original Medicare with the Medigap policy, where you can see about 98% of doctors across the country. There are some additional perks, though, of Medicare Advantage, such as a lot of plans offer vision or dental services, hearing aid programs, transportation programs, and so there are a lot of additional benefits included within these options too that can make it an attractive offering, in addition to the administrative ease of having it all coordinated by one single person. But on this slide, you can see an example of where this can break down for somebody based on the provider. So here on the right side, you can see some key characteristics of a plan. It's a Medicare Advantage plan. You see here the monthly premium is $0. You see there's no health or drug deductible, but you have this out-of-pocket maximum that you could pay if you need healthcare services. So this all sounds great, especially if I'm healthy. Here I have one prescription medication, it won't cost me much, and all of my doctors are covered. Fantastic. That could be a really good option for somebody. But here in this option in the middle, you can see none of the doctors are covered. So this is an additional consideration that comes into play when you are considering Medicare Advantage. The networks are going to work very, very similarly to your employer plan or a marketplace plan, if you're familiar with that. Also, this out-of-pocket maximum is something that you want to closely monitor. Here you can see 3 pretty different options: $6,700, $7,550, or $3,900 here. That really change the potential out-of-pocket cost, or the potential maximum exposure, basically, of these plan options and to your financial plan ultimately. So when you're making this decision, or if you've already made the decision and you are considering changing, the 3 key kind of differences to summarize between original Medicare and Medicare Advantage from an access and flexibility standpoint are the networks. So those PPOs or potential HMOs might be applicable for you on Medicare Advantage, where they are not on original Medicare, as well as the authorizations and denials that are much higher on Medicare Advantage than on original Medicare. There's also that cost perspective that I just shared with you, where your fixed costs might be lower. So your premium might be $0, even though, again, you're going to pay for that Part B premium and the income adjustment. But your variable costs through the out-of-pocket maximum could be higher, whereas your deductible on original Medicare is a lot lower. Your variable costs are going to be a lot lower. So to summarize, if you want flexibility and predictability, usually original Medicare is for you. If you're okay with some limitations and prefer to reduce your monthly costs and you're okay with increased out-of-pocket costs, then Medicare Advantage could be for you. Those are pretty high-level summaries. Again, there's so much more into the details that you want to consider, but that is kind of a really brief overview of the two options. Here you can see why Medicare planning is so important to your financial plan. The reason why this webinar is being offered through Medicare Wealth Management is because at their disposal, they have the ability to use some cost calculators within their financial plan. And here you can see an example of that. These cost calculators have a few inputs to them, like income, where you live, your general healthcare utilization, and your type of coverage. And they can spit out a number, but your individual costs are going to be drastically different. Like everyone's needs are so different. And if you consider specifically medications into the mix, it's very, very likely that you will have, or that no one will have the exact same costs as you. Even if, for example, you and your spouse live in the same area or the same age, you've got the same retirement income, you're probably going to have two very, very different costs that you will incur. So this is a side-by-side comparison that's really going to show you the level of detail that Medicare Wealth Management is willing to go into with you when it comes to planning for your potential costs. And they want to encourage you to be educated on all the different costs that come with Medicare, because it's not as straightforward as just one premium, one deductible, and one out-of-pocket maximum that you're managing. It is a lot more complex than that when you get onto Medicare, and the choices that you make really drastically affect what you could pay. So here on the left-hand side, you can see somebody, this column here, where it says original Medicare on the top. And this person has no premium for Part A. They've worked those 40 work quarters, and they have an income adjustment on that Part B. You can see here it's $340 versus the base of about $164. They pay about $171 for that Medigap plan, but what that's doing is it's going to cap their total costs. All they got to pay is the deductible. So their out-of-pocket costs are about, at most, $230. Then they're going to pay for their prescription drug plan. You can see here, pretty inexpensive. Income adjustment on top of that, circled in red. All in every year, or every month rather, they pay about $550. Add in their drug costs and their potential out-of-pocket medical costs, and you've got about $6,800. Not far off from this number I just showed you, right? But if they go on to Medicare Advantage, for example, here you can see how those costs differ. Again, you have your Part A and your Part B. Income adjustment still applies. No premium for that Medicare Advantage plan, but you have this out-of-pocket maximum. And $6,700 is pretty average for Medicare Advantage. No drug plan premium, but you still pay the income adjustment. So every month you're looking at $372. Better drug coverage, it seems, by a little bit. No drug costs, but your total risk or your total exposure every year has now increased by about $4,000, a little bit more than that. So this is where you can see that the plan selections that you pick really, really impact your potential costs. What we see over open enrollment is that there's a lot of opportunity to reduce those costs by realigning and reassessing your coverage. This is data that we've taken and shown across the clients that we've worked with, where you can see average savings across health plan premiums, prescription plan premiums, prescription drug costs, as well as medical tax deductions. Now that your advisor could have more information about your specific spending, they could coincide this with your tax planning strategy as well, and potentially encourage you to itemize those expenses. So with this basic knowledge now around Medicare, what I want to encourage everyone watching this webinar to do is to think about, what are your priorities? What are the most important things to you when it comes to picking your insurance plan? Is it most of your healthcare providers being covered? Is it having a recognizable insurance carrier? Is it lowering your monthly fixed costs? Is it lowering your total annual financial risk? Is it a plan with a high rating, or is it keeping your current insurance carrier? These are kind of the 6 different categories that we like to encourage clients to really think about before they go and evaluate any costs, before they go and shop around, before they talk to anyone about their potential coverage. These are the things that you really want to be looking at and assessing and figuring out what is most important to you. Here you can see how some of those preferences come into play. So based on the $0 premium that you can see in row 4, you can tell that this is a Medicare Advantage plan. Hopefully you're with me on that. And you can see that there are different options here offered to this individual and different things to consider. Maybe you want to optimize for your doctor's cover. Maybe you want to optimize for a recognized carrier, or maybe you want to lower your total risk. Maybe you want a high rating. Maybe you want a PPO option. There's so many different things that can play into your specific choice and what's most important to you. And you really want to be thinking that through again before you go shop around, because otherwise you could be swayed by other factors. Just to kind of really drive this point home across kind of the fact that everyone's personalized costs are very different. Here you see a very, very similar chart to the one that I showed you a few minutes ago, but we see original Medicare costs are almost $12,000, and here Medicare Advantage costs are over $15,000. This is actually not really due to drug costs. I mean, we see some additional drug costs coming into play, but this has a lot to do about income and where the client lives and possibly the age because of this high Medigap policy, and then also because of this higher out-of-pocket maximum as well. So you see here much, much different costs. And this also differs from this example where we actually see Medicare Advantage come in with a lower total financial risk. So there are some counties and some carriers in those counties that offer very, very low out-of-pocket maximums. And those can be optimal choices for individuals if they're okay with some of the other restrictions of Medicare Advantage. So really important to assess your unique needs and the options available to you based on where you live as well as you're making this decision either for the very first time or during the open enrollment period. For the few folks here who are joining us because they will be aging into Medicare soon, you will, as I've walked through, go through a lot of changes in terms of your coverage, but something that really just drives this point home here before we wrap up is that the individual costs are hopefully about to go down. A lot of people come into Medicare either from the marketplace or from COBRA, which is a continuation of their employer coverage. Because the average retirement age is around 62, 63, most people are able to bridge that gap to Medicare eligibility if they're retiring, 63 and a half, all the way through to Medicare. But COBRA coverage can be very expensive. As you can see here, this client's paying about $3,100 for their COBRA coverage, or maybe this was a private plan that they were purchasing outside of the public marketplace. Much, much higher monthly fixed fees, lower out-of-pocket maximum, at least in comparison to Medicare Advantage. But you see here total risk profile is very, very high in consideration to Medicare, which is about $5,000 on the original side or about $9,600 on the Medicare Advantage side. So hopefully if you are watching this because you're aging into Medicare, hopefully you're about to see your costs go down instead of go up, but it could be that it could go up depending on how rich or how much subsidized your employer plan and your employer coverage is. Some people come from very, very rich employer benefits where maybe they're used to a $0 out-of-pocket maximum or a $500 out-of-pocket maximum, and their employer pays 75% plus of the premium. In that case, you're likely to see your costs increase, especially if you have an income adjustment. So now let's get into the meat of the actual changes that you can make. To really drive this home here and bring us through the last few minutes of this webinar, I want to talk to you about all the changes that you can make now that you have a good, thorough understanding of the actual coverage itself. Open enrollment runs from October 15th to December 7th. And what you can do during this time is you can change from a Medigap plan to a Medicare Advantage plan and vice versa. You can change your Medigap plan. You can switch from Medicare Advantage to another Medicare Advantage plan, and you can join, switch, or drop a Medicare drug plan. Now, let me go through that all again and walk you through what needs approval and what doesn't. First, if you want to go from Medigap to Medicare Advantage, no questions asked. A Medicare Advantage plan will take you without asking you a single question related to your health history. If you want to do the reverse though, and go from Medicare Advantage to original Medicare and buy that Medigap policy to plug the 20% that parts A and B don't cover, you will have to go through medical underwriting, unless you live in one of those states where you have guaranteed issue rights that I mentioned. Additionally, if you just want to switch your Medigap plan, you have to go through medical underwriting. If you want to switch your Medicare Advantage plan, it's no questions asked. And if you want to join, switch, or drop a Medicare drug plan, it's no questions asked. Again, majority of people on Medicare drug coverage, whether that's Part D on original Medicare or a Medicare Advantage plan that has drug coverage, are not on the most optimized plan. And that's because, as you can see in the statistic, most, between 80 to 90%, do not review their coverage annually. So this is your chance and your opportunity to really reduce those costs. All of the changes that you make before December 7th will go into effect January 1st. There's actually an additional period. It's called the Medicare Advantage Open Enrollment period, and this is going to run from January 1st to March 31st. And what you can do during this time is you can switch your Medicare Advantage plan, just like in the fall, no questions asked. And you can drop your Medicare Advantage plan and return to original Medicare, joining a separate Medicare drug plan and Medigap plan. But again, for that Medigap plan, underwriting may be required. So you want to make sure, if you're first enrolling in Medicare or you're new to Medicare and you're young and you're healthy, make any of those changes now, so that if you do start to have certain chronic conditions, medications, treatments that you have, they will look at those if you're looking to change that Medigap plan in the future. What you can't do is you can't switch from original Medicare to a Medicare Advantage plan. You can't join a Medicare drug plan if you're on original Medicare and don't already have one, nor can you switch your Medicare drug plan if you're on original Medicare. So what I like to tell clients is make all of your changes in November. Don't worry about this additional period and what you can and can't do. If you can make any changes, you can do them in November. So explore them then, and you don't have to worry about the additional timelines or potential deadlines here. Any of the changes, though, that you do make between January 1st and March 31st are going to go into effect the first of the next month that you made them. And with that, thank you so much for attending. If you have any questions about any of the material that we went through, please contact your financial advisor at Madera Wealth Management. Again, good luck with this upcoming open enrollment season, and hopefully see you soon.